I am Dr. Ben Gonzalez, and this is Dr. G's Corner. There is no doubt that there is a different stress going on with children and young adults, especially in the last year of COVID restrictions. With the decrease of social interaction, increased dependency on internet and virtual connections, there's been a loss of the usual social development. Stress is not all negative. We learn from stress. Humans develop coping skills from stress. However, with the social restrictions of the pandemic, the increased dependency on virtual connections, online elementary, middle, high school, and even college classes, social development of the young mind has shifted, even faltered. Cognitive and social stimulation has narrowed. Opportunities for youth development into the adult world have, shifted. The Center for the Development for Developing Adolescents has talked about how the lack of hands-on experiences stunt the development of youth and youth-adult resiliency and purpose. What has been observed is an increase in overall anxiety, social paralysis, increased fear of moving forward in life, poor focus on goals, all leading to social isolation. The University of Michigan Department of Psychiatry talks about this disconnect in college students during a pandemic. Closed campuses, intramural sports, on-campus social events, and dormitory life even graduation ceremonies, all which would normally contribute to the usual stress in normal social development, have been taken away. A full discussion of coping mechanisms for all this goes beyond this 3-minute talk. However, I will say that finding and maintaining a routine, taking care of proper sleep and eating habits, along with staying connected with people as much as possible, in general, all help in managing anxiety. With all the side effects that go along with both short and long-term use of anti-anxiety medications, people are searching for alternatives. One of those alternatives is CBD. A high-quality, full-spectrum CBD is a safe alternative in helping with anxiety in children and young adults. The hesitancy for the use of CBD is usually due to the confusion of CBD with marijuana and THC products. Properly sourced CBD does not have the hallucinatory effects of THC. CBD has been has a well-studied high safety profile. Unfortunately, there is a saturation of CBD products not well regulated commercially. The American Academy of Pediatrics does not yet endorse the use of CBD in children. Unfortunately, they're still confused and they combine the CBD and THC as similar in their published writings. This falls into the trap of decades-old political discussions of Schedule I drugs. To be clear, CBD is a non-psychoactive compound. It is important to note that proper sourcing and dosing needs to be discussed with a knowledgeable medical provider, and that if your child is on medications or if you're a college student on medications of any kind, seek the advice of a physician knowledgeable in the use of CBD. A word of caution, and to be clear on my stance, I do not recommend any type of vaping as a delivery system for CBD, especially in children and young adults. So if you have any questions concerning the use of CBD, you can call my clinic at 301-622-2722 to set up a telephone appointment, and I'll be happy to answer your questions as they apply to you or your child. Again, that number is 301-622-2722. And just mention you heard me here on the station. Well, guys, I hope that helped. Next week, I will be talking about CBD in athletic performance.